Hi, I'm Charlotte Wool with Healthy Mom and Baby. You never forget your baby's birth. You will also remember the nurses who were at your side, seeing you safely through. Your nurses are there with expert care, support, encouragement, information, and resources as you begin breastfeeding. By simply sharing your desires to hold baby immediately after birth and to begin breastfeeding, your nurse will be your best ally in getting you and baby off to a great start. The first hour post-birth is called the golden hour with good reason. At birth, when baby is placed skin to skin with you, your body floods with the natural feel-good hormone oxytocin. This hormone helps you relax, bond with your newborn, and begin to recover from childbirth. Nestled against your warmth, baby's body temperature, blood sugar, and breathing stabilize, and his or her natural urge to start feeding is at its peak. Research tells us babies who spend time cuddled against mom's chest in those first hours are more successful with breastfeeding because you learn to recognize your baby's cues to eat. This immediate closeness with you provides everything he or she needs: nutrition, security, and warmth. In fact, did you know that if there have not been a lot of medications given during labor, babies can crawl and scoot their way naturally to their mother's breast and begin nursing on their own? Experts agree that you and your baby shouldn't be separated unless there's a medical reason. Spending time simply holding and cuddling your baby in the first days after birth will increase your confidence as a mom. Use this time to get to know your baby and to practice breastfeeding. Many first-time moms say it takes several days to feel confident with breastfeeding. This is where your nurse comes in. Just as your nurse provided expert care for you through labor and birth, she will now do an expert clinical evaluation of your baby. Your nurse can check your baby's heart rate and breathing and other health assessments while you're holding baby skin to skin. As you begin to breastfeed, your nurse can help you find comfortable positions and check your latch to help prevent any soreness. She may show you how to keep a feeding log and remind you your baby will eat 8 to 12 times daily in the first few weeks of life. Goodness, for a week or two, it may feel as if you are breastfeeding continually. But baby's regular nursing is also bringing in your milk supply. Remember, this brief period is short-lived. So get off to the best possible start. How you spend the first 48 hours with baby can ultimately set you up for breastfeeding success. It does take time for everything to come together. You and your baby will find your groove. Your nurse's reassuring words and helpful tips will help you establish a good foundation for breastfeeding, and you'll thank your nurse for it for years to come.